welcome MedTrace.
Good evening, ladies and gentlemen. My name is Cal. I'm the founder of MedTrace. MedTrace is in the business of combating counterfeit medications. Counterfeit medications is the largest segment in the counterfeit market. This is a $200 billion market, ladies and gentlemen. Unfortunately, this is leading to 1 million deaths per year. According to WHO, 10% of all the medications in the world are counterfeit. Counterfeits are sold in retail pharmacies in developing parts of the world. In America, they're sold online. Governments all across the world are implementing regulatory frameworks to address this huge problem. So let's see how it works. This is the pharma supply chain. Medications go from the manufacturer, shipped to a warehouse, then they are shipped to a retail pharmacy. At any of these transfer points are touch points, which is the weakest link counterfeiters introduce counterfeit medications. So how are we solving this problem? We're using blockchain technology. First, we capture the serial numbers of all the medications right from the manufacturer, store that in blockchain, and at every transfer point and touch point, whenever the medications are scanned, we verify it against the serial numbers in the blockchain. Patient can go to a retail pharmacy, scan a barcode, and they should be able to see the whole journey of the medication or the provenance. Blockchain, because of immutability, provides traceability, improves efficiency and lowers cost, and it can act as a trusted central authority. Our platform is built on Intersystems IRIS data platform, high transaction throughput with interoperability capabilities, analytics capabilities, and machine learning capabilities. This is a big, large firm at the Microsoft Nerd Center. So let's see how the product works. So we're registering all the participants into our network and approving the participants. Here, this is the manufacturer's enterprise resource planning system where they are entering the serial numbers of the medication. Once the serial numbers are entered, then the transaction is entered into the blockchain using a Ethereum adapter. Once the transactions are generated, we could go and check these transactions on the Ethereum through Etherscan.
We see how manufacturer sells these medicines to distributors network to legitimate and stores this information now we see this distributor's information system.
The distributor is selling part of the medication to the retailer. This is the distributor's ERP system. As soon as the distributor scans the medication, we store that into the Ethereum and verify that against our stored authorized serial numbers.
Okay, let's try to sell a fake medicine. And introducing the ID which doesn't, which is fraud. Let's try to save it.
Here we're trying to sell a fake medication, enter a transaction that doesn't exist on a blockchain, and this should deny the transaction. We have traction. We're working with 3 customers. Ahold Delhaize, which is the owner of Stop and Shop and 3,600 other grocery chain stores in the country. We're running a pilot with them. We're also running a big pilot with another grocery store in Spain. It's called the English Courthouse. And we're also running a pilot in India with a company called MedTrace. Unfortunately, India is the largest producer of counterfeit medications. We are seeking $500,000 in funding. We have a commitment of $250K so far, and we're looking for another $250K for a syndicate deal. Thank you so much, ladies and gentlemen. Happy to take your questions. Yes, sir.
Can you speak to your current financials and projected financials?
Sure. We are working on our pricing model at this time. We are running pilots, and we do not, at this time, we do not have a clear-cut idea about how much we can charge to different customers. But we have an idea. We are charging $1,000 per license for small businesses, and for enterprises, we're charging $5,000 per month as a SaaS-based model. But I'll be happy to have a one-on-one conversation with you to go over our financial model. But thank you. Yes, sir.
I have one question is about blockchain is pretty good at binding digitized data into the chain, but here you're actually binding the serial number, not the any digitized form of the pharmaceutical. And in India and other locations where I'm also working in some of those contexts, people are very good at taking the actual drug out of the packaging, putting something else back in. How do you anticipate in the market you're talking about that issue, that if you're binding the actual serial number, not the product?
Yes, sir. Yes. So our technology is not 100% proof. It works with other technologies to combat counterfeits. There's a technology called tagging technology, where you can mix taggants into the product itself, and using special scanners you can find these. So there are many ways to address these problems. One is through blockchain. Thank you. Yes, sir.
Out of curiosity, when counterfeit drugs are found, do any of the supply chain, do they pay fines? What are some of the incentives? I mean, obviously it helps to produce illness and death from fake drugs. What are some of the other incentives that are going to make them pick this up?
Can you repeat that question, please?
When bad drugs are found, who pays? Are they paying fines for this? What incentivizes them to adopt this?
Absolutely. That's a great question. Thank you. The question was, why would someone pay for this product? The biggest problem is losing the brand. For example, if the biggest problem for the manufacturer, if someone is selling fake medications on their brand, they're losing a huge brand. So this is loss of brand. Apart from securing the supply chain, pharmaceutical manufacturers are more concerned about protecting their brand. And that's why they will pay. Yes, sir. Chuck, I'm coming to you next.
If you indicated that, for instance, here in the U.S. and in Canada, the biggest problem is not through retail, but through online, how does your system work? Because online, they're compliant in the problem of selling counterfeit. They're part of the counterfeit world. So how how are you dealing with what seems to be a bigger problem, which is the online?
Yes, you can get the serial numbers online of that medication, and you can verify that against our system. And also, FDA is also giving a authentication mechanism and a badge to each online provider. These are the two ways online counterfeiting can be prevented. Thank you so much.